Welcome to True Health Tuesday. I waited to say that before you guys walked in. No, I didn't. He just gave me the go-ahead. How to use inflammation to reverse disease and regeneration of tissue. Now, we had one of these videos on last year that was wiped out and deleted. We have over 100 deleted videos now off of our YouTube channel. So we're going to do it again. But I've done something to placate the censors. And so hopefully we won't piss them off. So in the meantime, we've also started a new YouTube channel. I think we have 10 subscribers, not the 700 and something thousand on the regular one. It's called True Health Tuesdays. And we can't put the deleted videos on there, but we can repost, and hopefully the censors will kind of let us slide for a little bit. But the Dr. B VIP is the key. This one, and anyone that can support us, God bless you, thank you. It's extremely important. We do produce a boatload of videos, but also we're on Rumble, Odyssey, BitChute. But on the Dr. B VIP, we're going to have the second part of all of these talks, and it's all censored information, where you can't talk about injectables, you can't talk about a bunch. Now, the last Thursday of every month, we have an apprenticeship program, and this is getting really popular, where we're teaching everybody anatomy, physiology, neurology on every level. Because I'm telling you, if you're in the healthcare world, you probably forgot it, okay, unless you're utilizing it every day. But we're teaching moms and dads and parents and kids how the body works. I mean, it's really a fantastic program. And then Extreme Health Academy, I'm going to be answering questions for them this weekend, but once a month we do a two and a half hour webinar to answer questions from all around the world. So let's look at this. Inflammation, because if you're in any kind of world, you might think inflammation's bad. Well, let's look at this. Inflammatory diseases, Alzheimer's, autism, asthma, depression, strokes, cardiovascular disease, heart disease, diabetes, Parkinson's. Parkinson's is an inflammatory disease. Now remember, every cell in your body, your cells have to take in nutrients, produce proteins, and eliminate waste products. That's it. That's your job. So you're a protein producing machine. Now, inflammation has 4 parts, and rubo, dolor, calor, and dolor, pain. So pain, redness, swelling, okay, and heat. Now, it's hugely important that when you look at this, this is a healing process of the body. But when people say, no, inflammation can destroy you, they're talking about systemic inflammation or chronic inflammation. So a little bit of a damage, a little bit of tissue, like if you scratch yourself, you're going to break histamines or break the cells. Histamines are going to be released. But if you get 1,000 of those, like the old torture, death of 1,000 cuts, eventually you get enough damage to where your body, it exceeds your body's ability to repair. And then if you break down faster than you repair, that's called death or disease. Now, we're going to learn a couple of terms, and this is what we do in the apprenticeship program, pH. And you always hear this, oh, we need a high pH water. Okay, well, pH is just level of acid to base, okay? And your body has to have a certain level of that, like 7.35 to 7.45. But there's also areas of the body that are extremely acidic and areas of the body that are extremely alkaline. Now, oxidation is like rust, but it's a breakdown of material. And oxidative metabolic process is when you're breaking material down. Metabolism is building up and breaking down. Catabolism is breaking it down. Anabolism is building it up. And phytonutrients are the most amazing things. When we talk about inflammation, inflammation creates free radicals. And all plant products, okay, have certain antioxidants that deactivate those. And when you look at plants, and you got to look at colors. A blueberry is blue because it's fought off viruses, funguses, and bacteria. Carrot is purple. There are purple carrots, okay? There are yellow carrots. There's red carrots, okay? There's everything. There's, I think, Some higher up or queen in France liked orange carrots. That's why we always have orange carrots. But each one of those carrots have different phytonutrients that they've fought it off, and your body gets that nutrients in there. Now, we've got respiration, perspiration, urination. Okay, these are ways that your body can alkalinize, okay, in balancing pH, and also defecation. Now, that means that if you have a sedentary lifestyle and you're not respirating, guess what? That's carbon dioxide. I know what you're thinking. I just breathed without a mask covering on. I know. Makes you want to run out of the room. No, well, I mean, that's insane because you're rebreathing in an acid, and it doesn't help your immune system. But perspiration. So when people have kidney disorders or blood filtration disorders, which is what the kidneys do, we have them do deep breathing exercises. We increase their perspiration, so they're going to be sitting in an infrared sauna. Urination, we give them as much water as they can tolerate, okay? So it's fantastic. Now, when we look at this, the pH, acid-base balance, you can look here, stomach is way down on the end of it. The lower the pH, the more powerful it is. It literally denatures that material. Water should be good. Soda, baking soda is way, way alkaline. So you can see this, that everything has a different pH. And that's why your pancreas secretes, well, with an acidic medium, okay, your pancreas has got to work harder. And the pancreas is not just for insulin usage, it actually alkalinizes some of because it's right next to the stomach. You've got stomach that's got a huge low pH of acid, and so low that it can melt steel, it can melt metal, it can melt wood. I mean, it's amazing. But then it goes right into this area called the duodenum, and that's right where the gallbladder secretes and the pancreas. They go through the same opening. So if there's fats in the presence of that duodenum, bam, the fats are emulsified because you get the bile secreting. If there's more acidic, then the pancreas is going to secrete it. But you can imagine that if you have a very acidic diet, that means one not based in plants, you're eating toxic animals or chemicals like their glyphosates or something, your pancreas is going to have to work harder. Now, the things that cause a breakdown of cells, now remember, inflammation is how the body heals. So in your body is destroying 1 billion cells a day. Your body is building 1 billion cells a day. So that breakdown and build-up process is normal. This is how you live. This is how your body thrives on this planet. Now, there's a couple of things that accelerate the breakdown process. Poor diet, drugs. God, there's something there that starts with a V that's censored. You're going to have to come up with that, okay? Pollution, injury, natural aging, and stress. Now, that breakdown, because the body doesn't do anything halfway, when it breaks it down, there's free radicals that are formed, and the antioxidants have extra electrons that can deactivate those. So this is why when you're healing, plant-based diet is really, really good, but also antioxidants like vitamin C, glutathione. This is why that has such healing properties. Fibromyalgia, oxidative stress disorder. The third book I wrote was on how to correct fibromyalgia. And what do you think you got to do? You got to build cells faster than they break down. But this is out of the Rheumatology International. Oxidative antioxidant balances were changed in fibromyalgia. The increased free radical levels may be responsible for development of fibromyalgia. What is that? Increased free radical. That means the body's doing everything it can to heal. But remember, in the insane world that we're living in, remember, it's a chemically based education that the medical professional has. Okay? If they see inflammation, they give what? An anti-inflammatory. Okay? So that stops the healing process. So, and I get doctors all the time referring, patients over because we do stuff that's, unique. And I'll look at a patient and I'll say, well, you're prescribed Advil, Motrin, or Aleve. And they're looking at me, they go, yeah, my doctor gave it to me. And, they're pointing at the doctor sitting right next to them. And I said, well, inflammation's a healing process. 3 times this has happened where the patient looked over and says, is that true? And they got to look down at the ground and say, yeah, it is true, but that's how we're trained. It makes you more comfortable, but it also destroys your joints. Okay, because inflammation is a healing process. If you do anything to make that healing process more effective where it regenerates tissue, that's called a good thing. So bottom line, if you're breaking down and building 1 billion cells a day, if you break down more cells than you build, it's going to have a lack of ease. How would you say that? Dis-ease. I like that. Okay, remember that, John. That's going to catch on. Okay. Now, if you build your cells faster than you break down, what could you call that? Health. Damn it. This doctor is right on. Okay, so you build faster than you break down. That's called health. I like that. That's a good term. And you break down faster than you build up. That's called a lack of ease. Or what was that? Dis-ease. Damn. Okay, this is a real doctor. So when you look at this, and you can just imagine this. Now, we're going to talk about immune system responses. But if you get stuck by a splinter, okay, or stuck by a thorn, or stuck by anything, you're going to break cells and then initiates a massive inflammatory cascade. That's so cool. Okay, initially, blood just starts to flow through, so that's going to flush out the wound. And just like if anyone's had, you know, Girl Scout or Boy Scout training, do they still call them that? Yeah, I was a Boy Scout, okay? Okay, Girl Scouts here? Okay, yeah, okay, yeah. So you're taught first aid, basic first aid. Let it bleed a little bit, okay, then you bind the wound. So it bleeds a little bit to flush out the wound, and then all these cytokines, inflammatory cytokines mean cells. So these inflammatory cells go in there, and they start to chew up any abnormally placed cells. They start to, fibrin is formed, so this is where the scab comes from. I mean, it's just brilliant. And it happens all automatically. You don't have to say, look, I just scratched myself. Don't talk to me. I got to heal this. No, it heals automatically. Now, if we look at this, you've got two, I mean, the immune system is cool, but it's really your response to pathogens. And we're going to look at it, Th1, Th2 response. Th1 means that you get a massive response, and this is cellular, humoral. I mean, this gives cellular memory, so you're going to remember this. Okay, this is like childhood diseases. It's like stuff you'd get from your mom, too, that she would give you the IgMs, because experiences that she's had, she's going to pass on to you. So this is amazing. So if you Northern European, you have a history that you survived the Black Plague. How do I know that? Because you're here. If your relatives didn't, you wouldn't be here, okay, even if you identify with here. Okay, so you need a healthy gut flora. So, and this is when we say it's 80 to 90% of your immune system, it's hugely important. So this means if you've got bowel disorders, you got a weakened immune system. But on this stimulus, okay, some type of pathogen mounts this response, and you get cellular and humoral responses, long-term lasting, lifetime usually. Now, a Th2 is like a puncture wound. Now, I have something there, starts with a V, it says censored, a puncture wound. So the body needs an immediate response. So most puncture wounds that are of medical procedures that we can't talk about, okay, they trigger an inflammatory response. Some of the live puncture wounds, okay, can trigger both the humoral and cellular response, but it's mainly just an inflammatory response. So an inflammatory cells, cytokines. So this means that if you're doing this, medical procedure that starts with a V that we can't talk about, and it triggers an inflammatory response, we're going to see a boatload of inflammatory diseases, such as Alzheimer's, autism, asthma, inflammatory bowel disease. I mean, we'd have a population that is responding correctly based on the stimulus that we've given them. Okay? God, I want to censor me. Okay, so when you look at this, 54% of our children today have a chronic illness or disease that they never will recover from. And that's unusual. So like if you had a herd of water buffalo that 54% have a chronic illness or disease, do you think that herd's healthy or sick? Yeah, so obviously we're doing something not really good. Now, so inflammation, and this is a common thing. Remember, we have an industrialized medical industrial complex run by the pharmaceutical industry. We have a government run by the pharmaceutical industry, and we have a media run by the pharmaceutical industry. We have a school system run by the pharmaceutical industry, and we have research run by the pharmaceutical industry. So what are you going to get? Yes, pharmaceutical solution. How did you get that out of that, what I just said? Damn, he could really read between the lines. So let's give acetaminophen. Now, acetaminophen, we talked last week at the origin of it. We know it's one of the deadliest drugs in America, but it stops the inflammatory process. Okay, so it decreases, and remember, inflammation's how it heals. Now, impaired endogenous antioxidant defenses may have a role in pathogenesis of inflammatory pulmonary diseases, including asthma. So if you're giving acetaminophen, which is Tylenol or paracetamol, that's the main ingredient, okay, it decreases glutathione. Now, glutathione protects the brain. Okay, this is an antioxidant, so it's going to negatively affect how your body heals. Depletion of glutathione, and again, that's a side effect, or can't really say side effect, it's an effect, okay, of acetaminophen. Again, celiac disease. So how many people have pain, joint pain and things, and they take a chemical to alter that inflammatory response, and they end up with joint damage or destruction of the gut. Now, antioxidants, and again, this is how the body heals. The master one, glutathione. You could all say master is vitamin C, because there's so many things that you could do with this. But it's a main detoxification system, but this is one of the ones that protects the brain. And knowing that we have a massive rise in dementia and Alzheimer's, no, don't talk about politics. Okay, God, I hate when he brings that up. Okay, but dementia and Alzheimer's, not just in politics, okay? We're seeing it everywhere. And so we need to understand that could this be a negative effect with the toxic chemicals that are depleting what protects the brain? Okay, that makes a lot of sense. Sulfur-rich compounds, the cruciferous, garlic, onions, broccoli, kale, cabbage. I mean, there's so many things out there that are fantastic that build that glutathione level. Tylenol and non-steroidal anti-inflammatories. You might say, what class of drugs is Tylenol in? Anybody want to know? I'd like to. It's unknown. Nobody knows how it actually works, okay? So it's in a class of drugs by itself. I know. I don't know what this does, but I know it decreases proteoglycan production or causes joint destruction. It decreases glutathione production, so it causes brain destruction, and it limits your body's ability to heal. Oh, here's the Journal of Hepatology. It's said that the benefits are said by the Food and Drug Administration that to outweigh the risks, but still must be asked, is this amount of injury and death really acceptable for an over-the-counter pain reliever? No, I don't think anyone should be injured by medical care. I think people should be helped by medical care, not given a toxic chemical that limits their body's ability to heal. Kidney damage, skin damage, cardiovascular damage, increased risk of serious cardiovascular thrombotic events, heart attack, myocardial infarction, stroke, and this is on an over-the-counter pain reliever such as Advil, Motrin, Aleve. What is it doing? It's an anti-inflammatory. Inflammation is how the body heals. Okay, gastrointestinal, antacids. This is an article I just pulled up. According to the American College of Gastroenterology, heartburn is an unwelcome ailment that impacts 60 million Americans every month and 50 million every day. Indigestion, that means you're taking something that you can't digest, you can't break down. So now we would suggest masticating, chewing a little bit more, not drinking water during meals, okay, while you're eating, because that can dilute the acid. We would suggest juicing and blending if you're in a chronic state of stress, still affected with the physical, chemical, emotional stress, so that your body can produce more stomach acid, maybe a little bentane hydrochloric acid for no more than a month. So we've got multiple videos on digestion. So are there healthy solutions that you can have? Yes or yes? Absolutely. Absolutely. You're talking, you can correct reflux very, very quickly. Or you give an antacid, which increases esophageal cancer, and after 8 years, the researchers checked back with the individuals to assess how they've been medically classified as exhibiting cognitive deterioration. The people who took the heartburn medication regularly had a 44% increase in dementia than those that didn't take it. But they had less reflux. Criminal or criminal? Okay, this is why we've got to take back our society. Cortisol and thyroid, okay? You've got the adrenals and thyroid balance. Anytime there's inflammation, and I mean systemic inflammation. Wait, inflammation, isn't that coming from tissue damage? Yes or yes? So when I say systemic inflammation, it means there's a lot of damage. It means your body's breaking down faster than it's building up. And that was that term, dis-ease, okay? Okay, yeah, so this is crazy. So if you have elevated cortisol levels, if you have adrenal fatigue, you don't have elevated cortisol levels, you don't have adrenal fatigue. Look at the underlying cause. You have tissue damage. And if you break down faster than you build up, that's called disease. If you build your cells faster than they break down, that's called health. So when you're looking at cortisol levels, cortisol is the greatest thing you can have. Short term, it keeps you alive. Long term, it damages you. Short term, it's going to help metabolize fat, proteins, carbohydrates, helps your immune system respond. It helps with blood pressure, heart muscle tone. The problem is if you have it long term, this is like your long-term stress response. It breaks down cognitive performance. It slows down thyroid, blood sugar. Ever heard of type 2 diabetes? Decreased muscle mass. That's the #1 sign of aging. So if your muscles are breaking down, that means you're not building protein, okay? And you've got to build them. Lupus, migraines, menopause, diabetes, multiple sclerosis, all have an increase in cortisol. So what does that mean? That means those diseases are linked to tissue damage, not inflammation, tissue damage. The tissue damage leads to the inflammation. So this is why when you see multiple sclerosis, lupus, diabetes, in any one of those diseases, and someone comes to me and says, well, what can you do for lupus or multiple sclerosis or type 2 diabetes? I say, look, it's a tissue production problem, okay? Your cells are breaking down. We've got to build them, and we got to look at the physical, chemical, emotional stress. The diet in America is insane. Omega-3 to 6 ratio should be, or 6 to 3 ratio should be a 1-to-1 or 3-to-1 ratio. If you get super high omega-6, and this is factory farmed animals, you're looking at 60-to-1 corn oil. American diet is 21. Disease starts at an 8-to-1. So we are literally poisoning ourselves. If I say that, look, half of the population has some kind of dementia, but I'm talking about a herd of caribou, would you go up and check what they're eating? I mean, it just makes sense. Western diets are deficient in omega-3s, causing autoimmune diseases. Omega-3 is an antioxidant. It helps inflammation work. I mean, kidney damage. You know, they talk about, what is it, formula being short. Okay, there's actually things that you can do to build your own formula. Okay? I mean, one of the best recipes, I think it got it off of mothering.com, raw goat's milk, spirulina, and omega-3s. I know, it doesn't sound like yum unless you're this big, okay? And it works fantastic. So look at other alternatives. But a recent Washington University study that found that preschool kids aged 2 to 4 who ate organic fruits and vegetables had 6 times less pesticide residue in their bodies as children who ate conventional produce. Pesticides. When you're looking at pesticides, a lot of them damage the insect's digestive tract. Okay, and this is how the BT corn works. It destroys them. So do we have a healthy kid population, good healthy digestion, or are they bloated and sick? Okay. Now what disrupts your microflora? And again, we're looking at the intestinal tract, which is the majority of your immune system. Something V with a censored behind it, antibiotics, medication, and processed foods. That's it. So you have to avoid this. If you're taking medications that are life-saving, Fantastic. Find a doctor to find out why they're life-saving. Does your body already produce it? The CAFOs are insane. I mean, healthy animals are good for you if you want to eat them, but they got to be healthy. These commercially produced animals are bad for the animal, they're bad for the environment, and they produce a crappy product. Look at Farmers Direct. We've got a couple of patients that are farmers out in Texas, and I'm telling you, local farmers set up, because we're going to have a lot of food shortages coming up. Deal with the local farmers. You and a couple of your neighbors can split a cow, and I'm telling you, that's going to be 1/4 of a cow will last several months if you're eating a lot. Okay, 1/4 of a cow will help. But look at Farmers Direct. Look at all the other websites. Deal direct with these guys. Okay, and you're going to be able to thrive coming up. You've got to optimize your gut flora, because when we're talking about healthy, what is this? This is antioxidants. This gives your body the ability to break down and build up cells. Organic plant-based diet. Healthy fats. If you have damage to the brain because you've been taking antacids, if you have damage to the brain because your gut flora is destroyed, or you're taking blood pressure drugs, or all the other chemical interventions that the modern medical society thinks are appropriate for you, healthy fats help brain function. They've been using a high-fat diet or ketogenic diet for strokes and seizures and everything for years. Fermented veggies, probiotic supplements, juiced veggies, blended fruits, raw dairy, fantastic. I mean, 1 serving of fruits and vegetables a day lower your risk, and we're talking nothing exotic: spinach, kale, broccoli, fruits, oranges. Okay, it helps your blood. It helps the health of the blood. I mean, this is an old picture of my kitchen, and you'll see I put an archery target way at the end, and it's hard to see because this is one of those long houses. If you stood in the bedroom and you could shoot through the living room, kitchen, dining room, backyard, you get 35 yards. When you're, I mean, of course, when my boys were shooting, we made sure that nobody would step in front of the pathway, and after years of doing this, we still never shot anyone. But you're looking at everything, and this is how organized my kids were. We had apples, carrots, spinach, and celery. Okay, apples have malic acid, so they clean the kidneys, which most people have toxic blood, and that's going to help. Carrots turn into beta-carotene, which helps clean the lungs. Okay, celery is super good for minerals. Spinach is super good for nutrients. And we would put these in each jar. And when it's me and my 2 sons, okay, we do a jar of juice a day. Okay, within 7 days, that's 21 jars. So that's 1 week's supply. Juicing pre-digests this. So when you're in a stressed state or you have some digestive issues, the juicing can help pre-digest it. But here's a trick. Carbohydrate digestion begins in the mouth. So if you chew the juice when you're drinking it, you're going to help facilitate the breakdown of it. It allows you to get healthy amounts of vegetables in your system. It works really, really good, particularly when you're talking about inflammation. So when somebody says, "Oh, doc, what do I do with all the joint pain?" I said, well, increase your juicing so you can get that antioxidants, so you can get it. But I need pain relief. Yeah, vitamin C. Look at all the juicing. This has pain relievers in it, but it also has stuff in there so your body can build a healthy body. Phytonutrients. I mean, citrus fruits, vitamin A, vitamin C, vitamin E, copper, potassium, iodine, magnesium. It's all in these fresh vegetables. I mean, one of the best sources is sea plants, but it can't be from China or Japan. So locally harvested sea plants are excellent. Vitamin D, amazingly good for inflammation. You're talking 2,000 different processes. But this doesn't mean you spray sunblock everywhere, because a lot of those sunblocks have cancer-causing agents. You need that amount of vitamin D3, but when you get sunlight exposure, okay, you can't wash it off. Okay, you gotta, shower first, get out in the sun, and just leave it sit on your skin, because that's gonna produce the vitamin D. Vitamin D and K2. Eggs, butter, fermented foods, certain cheeses, dairy, I mean, amazing. Vitamin K. There's crazy doctors out there that say you can't have vitamin K because it clots blood. Okay, these are the things that have vitamin K in it. It doesn't increase clotting of the blood. Okay, it's involved in tissue repair that could clot areas that are exposed to it. I mean, I actually have an article that explains to doctors who, some of them say, don't eat any dark green leafy vegetables. They have vitamin K and they can cause blood clots. Can you imagine that? Okay, seeing a warning sign, back away from the broccoli. It has vitamin K in it. I mean, just completely ignorant. Inflammation is how the body heals. You take care of that inflammatory process and your body regenerates. This is why we talk about causing a local inflammatory response when we're doing the adjustment or when we're putting a heat pack on there, so you can increase the metabolism. It works. And when we're talking about nerve supply, that's making sure that you're in a healthy nervous system state, not a stress state. Exercise, you move every joint every day. Sufficient rest is when your body regenerates. So if you have chronic inflammation, I'm telling you right now, you're not going to be waking up refreshed. You're not sleeping deep. And what people will say, no, I sleep fine. I get up a couple of times, but I go right back to bed. Okay, you're not sleeping fine. I'm telling you that right now. Okay, proper nutrition. You can see the phytonutrients on that. And prayer and meditation. If you're not familiar with the spiritual war that we're going through, let me tell you, prayer is really, really cool now. I would totally recommend it. Okay, remember what Lincoln said. There are so many times that he had to go to his knees because there was no place else to go. Okay, and we're going to have challenges, and luckily, if you read that book, we win in the end. And by that book, I mean the Torah, the Quran, and the Bible. It's all Abrahamic faiths, okay? So look at them. They all have cool endings. Now, we're going to get into dangerous information, okay? Information that the censors will not allow. Hopefully, they'll allow this one. They've only wiped out about, I think, over 90 of our videos. They've shadow banned, they've demonetized. But you know what? What did they say in The Matrix? We are still here. Yeah. And by God, I'll be on an apple cart in the middle of the parking lot yelling it too. So we're going to get in.